Welcome to Combos from the Couch by LifeStance Health, where leading mental health professionals help guide you on your journey to a healthier, more fulfilling life. Welcome back to Combos from the Couch. I'm Nicolette Lianza, and today we're diving into a topic that affects many families: obsessive compulsive disorder in children. OCD is often misunderstood, and when it shows up in kids, it can be especially challenging for both the child and their parents to navigate. I'm joined by therapist Anthony Mason, and we'll be exploring what OCD looks like in kids and how it differs from typical childhood behaviors, and how families can find effective support and treatment. So, welcome, Anthony. Great to have you on.
Thank you so much. Glad to be here.
Tell us a little bit about yourself and what led you to a specialty in OCD.
So, I'm a licensed clinical social worker. I graduated in 2018 and I spent about 5 years in the school system. After that, I moved full time into private practice. There was a little bit of overlap where I did both, and I've been here ever since. What got me started with OCD is just the curiosity of it. We would watch like documentaries in my psych class about people with OCD and how they would have to check over and over again. And I just was really curious about what's going on inside their head.
Mm.
And that kind of led me down the path. It's a very fascinating topic.
Yeah, I agree. And it's a very complicated disorder. I think a lot of times people just assume it's like contamination or some of the checking, but there's so many different variants of OCD for sure.
Yes. Yeah,
And
it's a very specific thought process too. Um,
yes.
yeah, we often just see the what they do. We see the checking, we see the washing, but we don't
Hmm.
understand what's inside the head.
No, I agree for sure. So, what does OCD look like in kids, and how can we distinguish between some possible childhood quirks and behaviors that might signal OCD?
Yeah, so it's interesting. A lot of the OCD does look have a lot of the same features in children. It is the same rituals, it is the same obsessions, but we see a couple different things. First off, children are just a lot more emotional than adults are, and that's not a bad thing. I'm not saying that's a bad thing. It's just what
Right.
children are. So they often don't have the vocabulary to really explain what's
Hmm.
going on. As far as what's a quirk, often OCD will give a high level of discomfort. It's very unpleasant for the child to go through it. So some signs to look out for is if they express a lot of negative thoughts, a lot of negative self-talk. If they start doing rituals and then get really upset that you stop them, that's often a sign. And they will do a lot of checking too. They will often check locked doors and those type of
Hmm.
things. They also often look for reassurance. And they will do this, and since they don't know what reassurance seeking is, they'll also do it without asking. So they'll ask questions like, "Am I okay? Did I do wrong?" Those type of questions might indicate a lot of reassurance. They might apologize a lot. They might confess to things that are small, insignificant, and they would probably get away with, and then apologize right away. They might ask the same questions again and again. Should I keep going or?
Yeah, if you have a few
Okay.
more, throw them out there.
Yeah, another thing is avoidance. And kids will often avoid things. If they avoid school, that's pretty typical. If they avoid broccoli, that's pretty typical. But we're looking for kind of abnormal things to avoid.
Mm.
Some common ones are certain numbers, certain words, colors. You
Mm.
mentioned contamination. A lot of times kids don't really care about those things, so that's often a sign. You'll also see a lot of rigid thinkings. If you start hearing a lot of "I have to," or if I don't do this, then that's often a sign. Another big sign is just perfectionism.
Yeah, definitely.
Yeah,
So, what are some common misconceptions of OCD, and how do these sometimes delay getting proper help?
yeah, I think that we as a society don't understand what OCD is. We often think someone OCD is just someone who really likes things in a particular way. If you have someone who's just really set on making sure the picture frame is hanged level. We label them that's OCD. And that this often is not. OCD has a very specific thought process of an obsession, of a compulsion, of a ritual, and it's often very uncomfortable. I think that's one of the
Mm-hmm.
biggest things that was the difference between what we call quirks and OCD, is that OCD causes misery. Yeah.
Great word. It really does. And it's something that I think sometimes parents are like, just stop doing that. And it's not that easy. They can't just stop.
No,
It's
if they
causing them misery.
if,
Mhm.
if they could stop, they would.
Gosh, again, it just shows how complicated this disorder is for sure.
Yes.
So, how does OCD typically impact a child's daily life, like at home, school, and in social situations?
Yeah, we already talked about the misery part, and I don't think that can be said enough. OCD is a very miserable condition. It just causes so much discomfort, and that's alone is enough, I think, to call for treatment. But it does interrupt the life in a lot of different ways. It does take up a lot of time. Doing the rituals take time. I've had clients who do them for like hours on end. So it interrupts. They'll be late for school. They won't have time to do homework. They won't have time to see friends. It could
Right.
also be a very controlling disorders, and it controls them, but they also try to get it to control others. So
Yeah.
there was one case study I read. There was two bathrooms in the house, and one of the children or teen, I believe it was a young teen, wouldn't let anyone use that bathroom out of fear of contamination. So it doesn't only affect them, but it starts to affect others, which can damage relationships quite a bit. Yeah.
Yeah, I can see how that might cause some tension in the home as well.
Absolutely. And if you're so busy thinking about this, you're also just not thinking about other things. You're not,
Very true.
if you're so focused on contamination, you're not going to think about school or your future or extracurriculars.
Right. I can only imagine. That's for sure.
Yeah.
So, what treatment approaches have you found most effective for kids, and what role do loved ones play in the treatment
Yeah. So
process?
a lot of the treatment is almost the same as with adults. It is a lot of education. You have
Mhm.
to simplify the language a lot, obviously, but it is a lot of education on what it is and what's happening to the brain. It's also there is an element of exposures too, which is
Mhm.
very difficult because again, children are emotional, so it's hard for them to face what they fear when they just have so much fear. So you really have to be slow and gentle. Something I like to do a lot with kids, I usually start with this just to help with the education, is I try to separate them from the OCD. So they actually often will really resonate with this concept that there is like this separate entity in their head that's causing them to do it. They think it's them, obviously, which makes sense. It's coming from inside their head. Who else would it be? But as soon
Mhm.
as you start explaining it like that, they really resonate with it. And it does give them some comfort to know it's not their fault. So oftentimes I'll do that kind of education with them. I will have them name the entity, I'll have them draw the entity, just label it, and then a lot of the work will be like, okay, do you think there's contamination, or does the monster think it's
That's great.
contamination? As far as loved ones, it's a really hard disorder, especially for parents, because we, as a society, and especially parents, we just want to comfort the children. Like when we
Right.
see a child, we just want to tell them it's okay, it's gonna be fine, and it is. That's not a lie. But at some point, that reassurance is what they're looking for. So if you keep
Right.
giving them that, they're gonna just keep coming back to it again and again, and eventually ask for more. OCD grows if it's fed. So it's really a lot of my work is also training the parent to say, you can't keep giving them reassurance. You can't do that anymore. You
Right.
have
And
to.
that's the hardest part. I would think
It
that would be
is.
so hard.
It is
Yeah.
hard. And I have a lot of parents who don't engage, which I get it, or they
Mhm.
don't engage with it right away. They need time to figure out themselves. As adults, when we see a sad child, we just want to hug them, tell them it's okay, tell them that nothing's going to harm them. And again, that's true. And most of the time, that is the right thing to do with an upset child. But with OCD, that's what the OCD is looking for. So by doing
Mhm.
it, it's just feeding it. So it's really about helping the parent set the boundaries, not giving them all the reassurance, not doing what the OCD says. If the OCD is telling the kid that they have to keep mom out of the bathroom, we have to teach mom, no, you can go in the bathroom. The
Yeah.
OCD cannot control you. You really have to set up firm boundaries, and you're going to have to make yourself uncomfortable too, along with the child.
And I think probably a lot of parents probably aren't prepared for that or realize that.
No, and they often don't believe it at first.
Mm.
They often will they'll just nod their head, smile, and then continue to do it. And then things don't change, and then eventually they get on board with it. That's something I've seen before too.
Good.
What I've helped a lot with that is giving them resources. Like, it's not just me who's saying this, it's everyone.
There's science that back it. It's
There
evidence
is.
based.
Yeah.
Yeah. Yeah. Any other insights or takeaways you'd like to share?
I just want to, yeah, OCD, it can be challenging, but it is treatable. There's no cure,
Hmm.
unfortunately, but you can manage it.
Yeah.
And I think it's going to be ups and downs, unfortunately, and that's okay. That's not
Yeah.
a sign that you're failing. That's not a sign we're going backwards. That's just the condition, and that's most mental health conditions. So,
Right. Yeah, I appreciate you giving some hope there,
yeah,
especially when it can feel like it's a lot trying to navigate for the parents and for the kids. So, helping people understand that it is something that can be managed and people can get better from it. I think
they
that's the
can.
key.
Yes.
Thank you, Anthony. Thank you for sharing all your insights about treatment for OCD with kids.
Thank you for having me here.
Welcome. I'd also like to thank the team behind the podcast, Jason Clayton and Juliana Whitten. Thank you for listening to Converse from the Couch. Take care, everyone.